So Tanzania Development Trust works in rural Tanzania, areas that are not on any map, which is why we started this initiative, to map rural Tanzania. And we started in the areas where girls are at risk of FGM, female genital mutilation. I've posted the link to our site earlier, and I also put it with the recording. And we're really delighted to work with Jianting and the Summer of Maps team to look a little bit more about maps around FGM and so on. So Jianting is going to present her work now, and then there'll be, if you have any questions, please type them into the chat box. But then we'll also have a chance for people to ask questions orally at the end if they want to. So thank you very much. Welcome to the seminar, and over to you, Jianting.
Cool. Hi, everyone. My name is Jianting. I'm going to talk about my summer project, Crowdsourced Mapping to support sustainable development in rural Tanzania. So just a little intro to myself. My name is Jianting Zhao. I'm currently a Azavea Summer of Maps fellow. I recently graduated from the University of Pennsylvania, studied urban spatial analytics, and had a bachelor degree in landscape architecture from the University of Wisconsin. And a brief intro to the programs I'm working on, I'm doing. The Azavea Summer of Maps is a 3-month fellowship where student GIS analysts conduct geospatial analysis for local and national NGO projects. So this summer I'm working with Human Computation Group, Human Computation Institute, and Tanzania Development Trust. Human Computation Institute is the lead organization on this project, and they're working in their organization to focus on societal problems. And Tanzania Development Trust is a charity based in UK that helps provide improved livelihood in Tanzania. Together, they have a joint project called Crowd2 Map Tanzania that aims to map Tanzania infrastructure and FGM incidents on OpenStreetMap. Let me give you a project overview. Crowd2 Map volunteers collected FGM incidents from 32 villages in Mara region, Tanzania. As shown on the map, they are concentrated in the central region. The data they collected are, for each village, how many people refuse to FGM, how many are cut, and how many are died. With the data, Crowd2 Map wants to use data analysis method to answer some questions. Where are areas with the most recorded FGM incidents? Where in Mara region is the least accessible to education and healthcare? Where are the factors affecting the number of FGM incidents? To answer those questions, I conducted several analysis tasks. In this presentation, I'll be talking about each of them. First was mapping FGM, then mapping accessibility, estimating population density, combining accessibility with population, and lastly, analyzing influential factors for FGM. And then I will have an overview of project evaluation and give a preliminary conclusion and talk about next possible steps. And finally, I'll answer, Janet and I will answer the questions you have. Let's get into mapping FGM. Here's an overview of all the FGM incidents. Larger circles means more cut incidents happened in that village. The red dots indicate there's a dead case in that village. And if you take a closer look, the Nyamburi, Isenye, and Itununu are the top 3 villages in terms of cut incidents. They each have 215 and then 170 and 71 incidents. The villages Mirenga Serengeti, Kisaka Serengeti, Niansu Rura, and Borenga Serengeti all had one girl died due to the cutting. Now let's look at the refuse incidents. Similarly, the larger circle means more refused cases. The top three are the top three that had the most refused cases are Mirenga Serengeti, Ntomara, and Kiambaki. And you may think that, oh, so how do the cut and refuse compare compare a contrast? Here is a map of the ratio of cut and refused. The red indicates cut incidents, and the blue indicates refused. You can see that a lot of them now have more refused cases than the cut. However, there are three villages that has really high proportion of cut: Isenye, Niambori, and Itununu. And people also think that, clan type might play in a role in the cutting incidents. So I look at the clan type as well. As you can see, the Wakira and Wanya Basi are the most popular clan types in these villages. As just a overview, the villages with the most cut incidents are also those that have high proportion of cut versus total. Those villages are Niambari, Isenye, and Itununu. And the second test is to map accessibility. What does it mean? It means to use access mod to measure how long people need to walk from their location to their nearest education or healthcare facilities. And I want to show you a more detailed illustration of how the things combine to the accessibility map. So firstly, you have some many layers of raw data, and then the first three raw data: topography, land cover, and map of roads, combine into one of the input layers called the effort it takes to walk. And then the water body will become a physical barrier because you can't really walk through a body of water. And then I define the walking speed. I define the paved ground as 5 kilometers per hour and unpaved ground as 3 kilometers per hour. And then these three input layers combine together to form a layer showing how long it takes to get somewhere based on your route. So the data that I put into the input layer are the word shapefile, primary and secondary school locations, health facilities locations, road, building, and village name data, digital elevation model, which is the topography, and land use. Here I'll show several accessibility maps. The first one is the access to healthcare. From the lighter color to dark, it ranges from within 30 minutes walk to healthcare to up to 17 hours. And you can see that the western Mara region is definitely more accessible than the eastern region. This is a map of accessibility to primary schools. Similarly, it ranges from lighter color to dark, from less than half an hour away to up to 30 hours away. And this is the similar map for secondary schools. And people may think that, oh, so the Eastern Mara needs a lot more facilities. But is it really? Like, some people may think that the accessibility didn't take population into account. If there's no people, then it doesn't need to be accessible. So let's look at the population by wards. It's not surprisingly that the southeastern part of Mara region has very few people living there. So that's where of course, the facility will be hard to get. There will not be many. However, I don't think this map is precise enough. I want to know the exact population density distribution. However, I can't find the information online, so I made it myself. I used so my second task is to estimate population density. Without knowing the exact density distribution, I used a method called asymmetric mapping, which is to estimate population density based on density of roads. I assume that more roads in an area means more people living there. This is a illustration explains how the estimation works. So imagine all the cubes are equally height. That's like the population by wards. And then I have this density layer. I combine them, and then it'll redistribute the evenly height cubes into differently height cubes. This is what exactly I'm going to do. This is a map of the road density. With this road density combining with population by wards, I got a population density estimation for Mara region. And it's not surprising to see that the eastern and southeastern part of Mara region is mostly absent of human settlement. So then how population density relate to FGM? In fact, lots of FGM cases are recorded in low population density areas, which is shown in this map in gray, dark blue, and the blue color. With the population density, it will be interesting to see which areas are actually inaccessible. By inaccessible, I mean that areas that are more than 1 hour away from either healthcare, primary school, or secondary school. Yet those areas are more than 200 people per square kilometers. This map is showing the lack of access to healthcare. Look at the northern Mara region near the Tanzania border. There are a lot of inaccessibility. This one is showing the lack of access to primary schools. And this one is lack of access to secondary schools. The lack of access kind of spreads out in the western part of Mara region. So how is accessibility related to FGM cases? Here is a map overlaying all the inaccessible maps. And you can see that there are a lot of inaccessibility near the northern Tanzania border. However, the accessibility doesn't really relate to the FGM cases. Let's switch the brain a little bit. Remember the map of cut versus refused I showed earlier? Let's use a statistical method to study if there is any factor that's influential to the proportion of being cut. The method I use to study the influential factors is called the linear regression. To explain it in simple words, if you draw the points like the chart on the left, you will find a line that fits, that best fits the points. In this analysis, I'm trying to find this best fit line. The factor that I take into account are called predictor variables, and the predicted proportion of cut is called the response variable. So here's a list of the variables I used. As just said, the response variable is the cut as proportion to total recorded incidents. Predictor variable, the first one is Tanzania poverty estimation. Second one is healthcare accessibility. Then the primary accessibility, secondary school accessibility, and population density estimation. And finally, the clan type. After running the regression, the healthcare accessibility and clan type Wasanya are showing a significant. With 32 data, it may not be very accurate. However, this is good to be used as a prototype for further analysis. When the Crowd2Map feeds in more data, the model will get more accurate. So those are all the tests I've done to answer the original question. As an overview, there are a couple pros and cons I'd like to share. For the pros, first, thanks to the effort of Crowd2Map, we have a lot of accurately and densely mapped infrastructure data. And also there are a lot of open data, such as topography, land use, municipal boundaries, and population. However, there are limited FGM data, currently only from 32 villages. And also, we didn't really know much about the people, like their education level, where they live, their wealth level. And lastly, it would be nice to have more clan data in general, like the clans for people who are not involved with FGM. The above information draws my preliminary conclusion. We should prioritize the FGM intervention effort in Nyamburi, Isenya, and Itununu villages. And if you're interested in increasing more accessibility, focus on Kenya border. There are a large coverage of inaccessible areas. In terms of influential factors, the clan Waisenya, which is in the village of Isenya, and the accessibility to healthcare are influential to the proportion of cut over total. Finally, more safe house data will provide more accurate model. Here are several possible next steps for this project. The first one is we can turn the accessibility map into web maps, so people can zoom in and out freely. And also, it would be nice to study how the Crowd2Map mapping effort has an impact on reducing FGM incidents. And third, definitely collect more FGM data. And finally, it's possible to experiment analysis of various methods to analyze influential factors. Thank you very much, and I welcome any questions.
Fantastic. Thank you so much. I've written a few things in the chat box.
Okay.
Just as a little bit of background about the safe house and so on, in case people weren't aware of it. Does anybody have any questions? You can either type them in the chat box, or feel free to unmute yourself. We will, of course, be sending the recording and the slides around later if people want to have more time to study them.
This is Patricia. Could I ask a question?
Yes.
Yes.
Thank you. First of all, I just wanted to congratulate you. This is really solid work and impressive, and I'm really glad to see that what you're doing, and thank you for that.
Thank you. Yep.
I just wanted to see if you could give a little bit more detail about what you do know about what the crowd mapping efforts, how they are helping with your analysis. I mean, I'm reading in between the lines and thinking that when you did the population density, for example, that was really important for you to have the accurate roads to be able to do a very good model of that. That was one thing that I interpreted from your presentation was a direct result of the crowd mapping itself. So I was wondering if there were some other areas or if that was correct, and what else you could say in detail about that crowdsourced data.
I think the crowdsourced data has been really helpful to this project. For example, I wouldn't be able to know where the villages are, and the human settlement estimation. I think that's all the effort of Crowd2Map. Is there anything?
Can I just add, certainly from the point of view of the health of the staff at the Safe House, when the Safe House was opened in December 2014, they really had no maps of the surrounding area. So if they had a phone call saying there's girls at risk in Kabancha village, they didn't have any maps showing where that was, and now they do have maps. So, and they also so they have a printed map, but they also have access to maps on their phone, so that they can actually put in the name of the village in Maps.me, and it will now show them the quickest way to get there. So it's been very, very helpful from a navigation point of view. Also, because they're running on a shoestring, they often didn't have enough fuel to get places, so it was allowing them to estimate the amount of fuel they needed so that they didn't run out, and the quickest way to get to particular villages. So the feedback from the Safe House staff has been that the mapping has made their life much, much easier and allowed them to rescue girls that they wouldn't have been able to do without the maps.
Yeah.
Any more questions? Okay, so thank you. Melanie says she's going to follow up with some questions because she's got to.
Oh, yeah.
Anybody else? I mean, certainly one of the areas that we particularly want to do more work on is the issue of clans and where different clans are based. So that's certainly something that we're very interested in, and we want to work with the Safe House staff and others to actually map that.
Mm-hmm. Yeah. Any other questions?
Okay, well, you have our contact details. I will be circulating this, and if people have any questions, please do follow up. And I'd really like to thank this whole Summer of Maps project. It's been absolutely fantastic working with you both. So thank you.
Thank you too. It's a great project.